I wonder if it's worth. I might try and keep the whole thing on there actually.
Just to give it extra.
Yeah, yeah. Absolutely. But we don't want it to be stimulating too much of his face. That's the only thing. So I might just take the corners off.
I see.
So that's why we try and keep the more sticker, the more surface area, the better. Because if it's less, the electrical stimulation is going to be more dense in that area, and it could be a bit more uncomfortable or like too intense. So the bigger the space on the sticker, the better.
It spreads.
Yeah.
I see.
Yeah.
Wow.
And the further apart the electrodes, the deeper the stimulation. But because it's next, so that's why we never want to have them directly next to each other, because the electrodes talk to each other. So the electrical stimulation is innervating the muscles only as far as the electrodes are. So if we pull the electrodes apart further apart, all the muscle tissue in between them is being stimulated deeper. If that makes sense.
Yeah.
But he's just got such a teeny tiny little neck. You're yawning already. So he's got these little electrodes. Okay, so this is called Vitalstim. It's just a brand name for neuromuscular electrical stimulation. So what I've done is I've put electrodes on certain muscles. They're going to help with pulling his tongue back during a swallow. So at the moment he's got a delayed initiation of swallow. So the muscles that we're targeting with the electrical stimulation is going to help to retract and pull that tongue base back and have a safe swallow. So at the moment I'm alternating between the electrodes being on either side of his thyroid notch and just above the thyroid notch around his hyoid. So these are called placements A or placements B. I'm just alternating on one placement, one session, and then change it up the next session. Okay. All right, buddy. So we're going to turn it on. Okay. So I'm going to start to turn up the intensity and just wait for a reaction from him. So when he reacts with his body, we know that it's starting to work.
Is that a reaction?
Yes.
Yeah.
So the first thing he'll feel is the sensory component. So it's kind of like a little tingling sensation, kind of like pins and needles when you have a dead foot or something. But what we want is to keep increasing the intensity so you get the motor component where it actually pulls on the muscles. So with babies or non-verbal kids, it is all about just watching their body language. So nothing about this is painful. Buddy, you're doing some funny facials there. Aren't you? Oh. There we go. So that was a little reaction. So it went down, it went back up again.
Lots of grunting.
Lots of grunting. Okay. Okay. Is it time for some food? Right. First thing we'll do is just a bit of facial stimulation. Hi. Hello. It feels weird, doesn't it? I know. So we still continued with the facial stimulation before mealtime. Hey, buddy. Avocado and yoga, yum. I'm going to have to try this. Oh, good opening. Good job, buddy.
Yeah, yummy. Yeah. Hi, kitty. Hello. It's your favorite. Avocado. Yeah. Yeah.
Okay. Oh, yum. Can you smell it? Oh, good opening. Good boy. Good job. Good job. Nice little swallow there, mister. There we go. So I'm just wanting to put the spoon in here just so he's getting that sensation inside, because you can see how he's still got quite a bit of residue in his mouth. So he had an initial swallow, which was great, which took his majority of the food down, but he's still got...
He needs another one.
Yeah. So he's not quite got the... He needs to swallow just yet. See all the layer of whatever is not... Yeah. Okay, buddy. Oh. Oh, good job. Oh, beautiful. So he's very much still got this tongue thrust. So you can see when we pop the spoon in, that tongue comes straight out. So we're just trying to teach him the correct movements with his mouth. So waiting till the mouth opens to put the spoon in and just holding up the spoon at the top and then giving him a tactile cue to push the chin up and the lip to scoop the food up. Good job, buddy. So you can see with his kind of premature movement of his tongue, he's just got this back and forward movement, so he's probably feeling all this on here, but there's not too much range of movement that he can do.
So that's probably why we have to get the left to right
Exactly.
going, so he can actually circulate his tongue.
Exactly. The more range of movement we get with his tongue, the better. So that's where those little chewy tools come in handy, where you can put on the end of the Z5 here. So we'll use that in a minute. So we've got the different tubes here, this one as well. So just putting food in there and putting it on the side there. So he's just practicing that up and down chewing movement, and he also instinctively just moves his tongue to the side to try and get the food. Yeah. But at the moment, he has no reason to move his tongue to the side. Oh, good opening, buddy. Good job. You can see that tongue. Yum, 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 yum. Open. Good job. Good job. That was a nice big one. Are you ready for some more? Some more? Look at that little tongue go.
Yum.
Open and close. Good job. Good job. Work through that avocado, mister. I might chuck some on one of the little tubes and put it on the side of his mouth. Yeah. Okay. Okie dokie. Okie dokie. Okay, so I'm just using one of these little tools. So this is again one of ARC's therapy tools, just on the Z-Vibe.
So I don't know what I'm looking at. Like, I don't know if it's a hard tool or a soft tool.
It should usually state whether it is a hard or a soft. So when I order them up directly from the ARC's website.
But I don't know what I need. Like, do I need a combination of both?
I would go for soft, definitely with
Soft,
him.
okay.
Yeah, while he doesn't have any teeth in there, he can still practice that chewing, but without hurting the gums. I mean, if you think of eating something hard, if you've ever had a missing tooth, or it's not as pleasant, but he still gets the actions of chewing, but obviously it's not going to be impacting his gums as much. So this one's quite soft. I think they call this one magenta online, just the purple one.
Right.
So I've just popped a bit of food.
It's vibrating.
Yep, so I've just turned the vibration on. Popped a bit of food on the inside as well, so when he does bite down, the food comes out. So it's just teaching him, the act of chewing, the up and down movement of the jaw, and getting a bit of food out of it as well. Okay, good opening. So putting it on the side, so we can get his tongue to move laterally. So last session he did really well with this, and his tongue was moving from side to side, which was great. So you can see how much his tongue is protruding out, it's coming out, which means, any kind of suspected tongue tie is...
Oh, yeah, that's okay.
Yeah.
No, I was just asking.
Yum. Good job, buddy. I like this because I like this activity, I guess, with the tool, because he's not got that tongue thrust. He's so used to sticking his tongue out during feeding, but when we put it on the side of his mouth, his tongue goes to the side, and he's just getting that up and down jaw movement, which is really great. So it looks more like he's chewing something. Alright. So the vibration is just a really great way to increase that oral sensation as well. So any child who, I guess, has decreased awareness of what's going on in their mouth, has a lot of leftover residue, just by putting the vibration in there, it just kind of wakes up all the muscles a little bit more. Just makes him a little bit more alert of what's happening in there. So he's biting down nicely. Good job. Good job. Open. Good boy. That's beautiful, isn't it? Chew, chew, chew. Open. Good job, buddy.